So, yes. Yeah, Jaya Lakshmi,
Sir,
you can start now.
good morning.
Good morning, nurse.
Have a seat.
Thank you very much.
Um, can I have your name and age for recording purpose?
Yeah, my name is Lincoln, Abraham Lincoln, and I am 60 years old. Nurse?
Okay, Mr. Lincoln. Wha- What brings to you today?
Yeah, I am actually recommended by the doctor to come and meet you. I want the details regarding this. I don't know what it is. Insulin injections. I don't know why the doctor is recommending me. Can you tell me the reason behind this, nurse?
Okay, Mr. Lincoln. I will explain you about the insulin injection. I'm one of the register nurse here. Don't worry about the injection. This is the common for the diabetes. Sugar levels is more you get means they will provide lot so many patients they're using. Don't worry about that. Easily, I will explain you how to use this one, how to uh, preserve all those things. I will explain. Uh, okay, are you okay?
Yeah, please go ahead.
Okay, firstly, I will explain for you. Insulin injection is you can use four places you can use this one. uh, one four places you can use this insulin injection. One is for left side of upper arm and right side of upper arm, and thigh, left thigh and right thigh, and you can use for abdomen also. Are you get my point?
Yes, of course, nurse.
Mm. Okay, Mr. Lincoln. Then again, I will explain about how to use the how much quantity you will take. Mr. Doctor will prescribe 5 units, 10 units, like that. How much doctor will prescribe for you about your problem? Then you can take the that insulin, and uh, you decide which place you have to take, because don't take daily same place. Today you will take left arm, tomorrow you will take right arm, and day after day you can take the stomach, or right thigh, or left thigh. Okay, do you get my point?
Yes, of course, nurse.
Okay, then the needle is 45 to 90 centimeters. You have to go inside. Then, first of all, you can clean the area which you selected, and clean it, and load. After loading your insulin, clean the area and take the muscle, and yeah, I will show you the tip. You have to go inside slowly and push it. Okay, do you got my point?
Yes, nurse, of course. That's very clear.
It is very difficult to do self injection, but so many people using. Don't worry about this, okay? It won't get that much of pain. It's very little needle, and then once using this insulin, you can recover very fast. Okay, then you will get good health for you. That's why doctor has suggest you. Do you have any queries about that?
Yeah, that's fine, nurse. Then tell me the other things. What I should do with this? Okay.
Mm,
Should I use the same syringes and needles every day, or
no.
should I take new ones? Or what about the used needles and syringes? Should I throw them off normal manner, or is there any special way to dispose them off?
Okay, I will explain you, Mr. Lincoln. Uh, Same syringes we should not use, Lincoln, because it's very rough. It won't go inside, and sterile procedure also not. We cannot do same syringes. Daily you have to change syringes because once you use same needles, you will get the infection. So because of that, we should not consider same syringes. We have to dispose the syringe every day. The process of disposing also uh, s- uh, should not throw anywhere it is. We have to cap it once, and then in the hospital side we have separate things. But because our house is very carefully, we have to throw proper way. Have to throw cap it and have to put in the dustbin carefully. Okay. And again, are you got my point, Mr. Lincoln?
Yes.
Hello, Mr. Lincoln, you got my
Yes,
point?
yes, of course, I got it, nurse.
And about the storage also, you asked me, right?
Yeah,
Yeah, storage also very important, Mr. Lincoln, because the insulin should not keep in outside the normal temperature. Okay, are you
okay,
good?
nurse. Yes, of course.
Then you have to keep in the fridge, not in the freezer. Freeze, normal
Okay,
domestic freeze you can keep, and
okay,
should not away from the children's. Okay,
okay,
if you
nurse.
have got any groundwater like that, you should not keep. Okay, very careful. Huh?
Yeah, sure, sure.
Do you have any queries?
Yes, nurse. Fine. I am not a nurse by profession, and maybe some problems will be there. What about the side effects and some ongoing problems because of these injections? What if I do something wrong and I end up in a problem?
Um, okay, Mr. Lincoln, I, I got your point. I will explain that. That's why I told you you should not use the same syringes, and you should not use about a same place every day. So
Okay,
if you do like this, it will absorb very fastly. One day it will recover, and the next day you can use the other way. Then you won't get like these problems. Okay. If you
okay,
get any problem, we are all available here. So we will solve your problem. Don't worry about that. Almost, I hope you won't get any problem of uh, mm, uh, about the injections.
okay, nurse. Yeah, that's very good. Thank you very much, nurse. Is there anything else that I need to know? Is there anything else that I need to know, nurse?
No, 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 Mr. Lincoln. Do you have any course? Let me know. I will
Yeah,
explain you.
what should I do with if this container is filled up?
So you have to dispose the container, uh, needles and all to biometric waste.
Okay, that's very fine. Thank you very much, nurse.
You will
Yeah,
come.
yes. So, Jaya and Lakshmi, you can mute back. Right. Jaya Lakshmi, in the previous session, I told I am one of the registered nurses, not nurse. So you made the same mistake here. I am, okay, maybe you were not there that time. Fine. I am one of the registered nurses. Now, what do you mean by this? Here, there are many nurses, and I am one of them, not one of one. So remember that. There's a mistake you are doing. So one nurse only and one of one means it's not good. It's not right. Then you can say the registered nurse. Okay. The one and only registered nurse. but it's not the case here. It is one of the registered nurses. The next one, many times, multiple times you are saying or these sounds. These sounds are not very fine. You have to avoid. You have to avoid from making these sounds as far as possible. So that's a problem. That's a serious problem. Because when you are making that sound, you're distracting the audience from understand. You're confusing, actually. You're not giving them that that free catch. In between, you are only obstructing because you're not presenting properly. Next one is you are you can use. In 2 seconds you can use. Why are you repeating? Don't you know that you have already told you can use? After 2 seconds, again you are saying you can use. And the same way, you can use 4 places. You can use 4 places. Why? You're repeating. Already you told, then it's finished. Then why don't you remember that you have already spoken this sentence and you need not repeat it? That's it. So this repetition is a problem. Repetition is a problem. Don't repeat something. It's not good for you. The next one, of that ending, dragging the endings of the that you're thinking something and you're dragging this one. No, of what? It should come immediately. And you don't know what to speak. So you're pulling that one and and you're waiting for 2 seconds, and then maybe you're getting an idea. The next one is, do you get my point? I don't know how many times you use this word. Do you get my point? Do not repeat the same phrase time and again. Next. Next, you said, are you got my point? What is this? Are you got my point is grammatically incorrect sentence. Have you got my point? That is present tense. Did you get my point is past tense. But what is this? Are you got my point? Okay, are you getting my point is present continuous tense. Now it is happening. So, but this are you got my point is totally, okay, it's not right. Avoid this style. Wrong sentence. Be grammatically correct. It will absorb very fastly. It will absorb very fastly. Is there a word called fastly in the dictionary? I don't know. Okay, check it out. Check it out whether there is a word called fastly. Slow, slowly. But fast, fast only, no fastly. How can you say fastly? Huh? How can you say fastly? You cannot say fastly because there is no word called fastly in the dictionary. If you are using it, it's a mistake. You should know that there is no ly form in fast for fast. Fast, fast. Slow, slowly. Quick, quickly. But fast, fast. Don't add ly to fast and say fastly. That's totally wrong. The next one. You said these problems. These problems. You can avoid this problem. These problems or these problems or this problem. This problem is correct. These problems correct. But these problems and these problem are wrong. Singular with singular, this problem. This is singular, problem is singular, so this problem. These plural, problems plural, so these problems. So you can use this. You can plural with plural, singular with singular. This is the collocation. This is the, assembling of things. Singular, demonstrative pronoun this with singular noun problem, this problem or these problems. But otherwise, it is wrong. Be careful. So these are some points which I have written. Now, yeah, Jaya Lakshmi, you can unmute. If you have anything, you can ask me. Afterwards, I'll give you some suggestions for improvement. Come on.
Sir,
Yeah.
క- um,
Are you hurt or
నాకు
offended
నాకు
by me?
అర్థమైంది సార్ ఏమేమి
No, in
no
English.
no no sir, I have
Only
to learn.
English. Only in English.
Yeah, I
Mm,
have to learn. I have to learn.
mm,
But I observed should not use the some points,
mm,
and we have to use singular to singular.
mm.
Like that. I need a lot of things.
Mm.
Again, I want to use. I should prepare a perfect.
Okay. Right. That's good. That's good. So now you can mute back. I'm giving you some sentences where you can improve your
Thank you.
quality.
Thank.
So now let me give you some sentences. One precaution, there are some precautions which you have to take. The first and foremost precaution is, yeah, what you have to do is avoid repeatedly taking insulin on the same site. There's a specific reason for this. You're going to avoid unwanted complications. If you repeatedly take the injection on the same side, for example, left shoulder, 1 day, 2 days, 3 days, you will land up in some problems. These are, for instance, there will be some bruising, or there may be some lump formation, or some other such sort of negative developments. So, in order to refrain from in order to avoid these unwanted complications, the best possible solution is to not repeatedly take on the same. So for this purpose, what are you supposed to do? So 1 day you take on the right shoulder, the next day you take on the left shoulder, and then you take on the, this is a, clockwise direction, clockwise direction or anti-clockwise direction. So this is anti-clockwise direction, clock. Okay, this is clockwise direction, right? And this is anti-clockwise for me. Okay, if I keep for you, you can see there how it is moving. So that is clockwise direction. You see for you, when you see this is 12, this is 6, this is 3, this is 9. So from 12 onwards, you will go this side. So this is 10, 10. Okay, 10 to 2, right? So now from right shoulder, left shoulder, then left thigh, 5, and then 8. So you can take 8. So right thigh, then the central. Okay. So 1, 2, 3, 4, and come to the center. Again, 1, 2, 3, 4, and come to the. So you are rotating the sides on a regular pattern so that you will not forget. And make sure that you note it down in your register, daily record, so that if you forget also, there is a chance of not committing any mistake, because this is a problem related to your health. So make down a note in your diary on what date, where you are taking, so that you will not miss anything. This is very important. This is all to avoid any unforeseen happenings which will render your health weakness to your body, or which will diminish or deteriorate your health. Fine. Then you can also say, like, another point, what I wanted to tell you is, after using these syringes and needles, after using these needles and syringes, be careful with the disposal. You have to follow some safe disposal methods. What you have to do is, you take these used things and straight away put it in a container. This is a container, this blue container, and this is a safe deposit container, disposal container. So I'm giving you this one. Now what you have to do is, once you use them, open the lid, put it inside, and immediately close the lid tightly, because there are sharp instruments, sharp container. There are sharp instruments, sharp glass pieces, and all these things. If unknowingly or by mistake you put somewhere, some children or some others unknowingly, they'll come and they'll touch them and they'll get hurt, needle prick. Okay, or they'll get cuts or bruises. So in order to avoid these things, safety is the best possible measure. So this is what is recommended. Do not dispose these as other ordinary materials, as how you dispose them. This should be treated very carefully. And next, if this container is a 3/4 full, immediately you have to follow up with us. Either call us or bring this container to us, and we will replace it with a brand new one or a fresh one, alternate second one. So that's very important. So this is about safe disposal of sharp instruments and glass pieces, whatever. So be careful. So you can use quality sentences like this. Right. So that is a Jaya Lakshmi. Yeah, we are done with this speaking session.